So the reason that I chose respiratory is because I kind of always knew that I wanted to be in the medical field. I just didn't know exactly what I wanted to do. Um, I was actually in the nursing program at another college, and my perspective kind of really changed when my dad came down with COPD. Seeing him like dependent on oxygen, like tethered to tubing always, and also like his aspirations. Um, that moved me, and then I just happened to find out while I was in nursing school about respiratory. The college that I was currently in didn't offer the program. I was in the very, very beginning of the program. So I just applied to see if to the closest college that had it to see if I could get in, and I did. So I feel like things happen for a reason. And once I learned about the field, everything kind of clicked in place for me. One of the things that excites me most about respiratory therapy is like the ability to help people breathe. It's like something that we all kind of we take it we take it for granted because we don't have to think about doing it. But when you can't do it, it becomes like so important because you can't you can't live without it. So it's exciting to help people in a meaningful way. One of my biggest concerns about becoming an RT is kind of keeping up with the new practices, the new equipment, stuff like that. But I know like as long as you're persistent and you put in the time and you're like committed to the learning, that you'll continue to grow. I've always like myself been a hands-on learner. Like I can watch something be done multiple times, sometimes 10 times, but it doesn't actually click for me until like I'm actually putting my hands on and doing it sometimes repetitively. Like that's what works for me. Um, Outside of school, I am a mom of four kids, ages 8 to 17. So, um, it's a lot. I've been married for 19 years to my best friend. So, I had to not only I went back to respiratory school at 38. So, it was a lot. But if I can do it as a mom of four while maintaining a house and like children, anybody can do it, I promise. You just really have to prioritize that. Early on in respiratory care, I thought that school would be difficult, which was accurate, but I learned that like once you figure out how you learn best, you can make it work. My understanding of what it means to be a respiratory therapist has definitely changed. I used to think it was like just giving breathing treatments, but now I see like how broad our career, like how broad it is, our scope of practice, like it really is. It's a lot of critical thinking, ventilator management, patient advocacy, things like that. One of my biggest concerns was definitely doing ABGs. It's an invasive thing, so it's a little bit scary. I think that goes for everybody. But as with anything else, practice makes perfect. You got to just keep doing it, keep pushing yourself, and you'll eventually perfect it. Now they changed the needles. They decided to do that. Once I thought I was a great stick, now they changed the needles. So, but I'm going to learn that too. So, um, but being a hands on learner has helped me grow in my daily responsibilities. Ventilator management used to really intimidate me, but now I understand um, like my role at the ventilator is like making sure that the vent is working for how each individual patient wants to breathe, not like trying to get the patient to deal with the vent, if that makes sense. There have been a lot of patients that have impacted me, but end of life care always sticks with me. So, like, terminal extubations, like, can be emotional things, and it's important for me to um, be helpful to the family that's there as much as my ability, but also when you're alone with a patient who's alone and doesn't have family there, it's just a special thing for me, and it always hits close, because imagine being alone, dying, and the only person there with you are a couple strangers with a few nice words to say while you pass. Like, if I could do that for them, it's special. My clinical reasoning has evolved a lot. I've learned that every situation is kind of different. Nothing is ever completely black and white. Like, respiratory has such a huge gray area. It's just every patient experience is definitely unique. My confidence definitely started to grow when I began to work as an extern, like being on your own. It like really builds your confidence quickly. That's when I really started to feel like an RT, is like just being out on my own. I've also learned over time to stay calm and always prioritize ventilation before oxygenation, because you can't push oxygen into somebody who's like not ventilating. Just that's how it works. So there's just things that you learn as you experience more things. I used to be like super task orientated and focused on getting through my checklist of things to do. Um, but now I understand that it really matters to address like each patient's individual needs. That's how you can actually make a difference. The values that guide my practice are centered around compassion and intention. I would say I try to treat every patient as if they're a member of my own family, and I ask myself what I can do to kind of make a difference for that patient. So that if it's one little thing I do for everybody, like it really adds up in the end. I've also learned that I'm never alone, that help is always available, whether it's a phone call or asking someone nearby, shouting down the hall to a nurse or a CNA or whoever's close. Respiratory therapy is definitely a team effort. I mean, we count on our other RTs, but as a hospital in the general, we all work together. So it's something that's given me comfort in my career. Moving forward, I do want to continue to like develop myself professionally. I plan to pursue like PFT credentials as well as my NPS. And I also want to keep improving my knowledge of like waveforms and troubleshooting. We have, I plan on kind of growing through a program that we have at work. It's a respiratory professional development program. So there is like cash incentives and stuff, but you're also like continuing to learn and push yourself, which is so important. Study tips that I can give for other people would be you really have to commit, and once you make respiratory a priority, everything else becomes more manageable. And for resilience, when you get knocked down, get back up again. Figure out why you fell down so you don't do it again. Also, lean on your instructors, listen to your preceptors, build your own style around everything that you learn. Most importantly, never be afraid to ask questions. There's no such thing as a stupid question, even if you ask it 10 times. They're there to help you. You can do this.